Awesome, Jessie. Well, welcome to the Back to Your Best Rehab Podcast.
Thank you.
Been wanting to have you on for a little while. It's actually been about a year since I did the last podcast with our move and all of the stuff happening in the clinic. I haven't been able to get around to getting these stories out, so I'm very excited to have you as the first one on
Excellent.
in the
I'm
2026
excited
year. But yeah, it's been so cool to see your progress over the last, I don't know what it's been now, probably 8-9 months or something like that.
Yeah, I feel like it might be getting close to the 12-month
It's
mark,
getting close
actually.
to 12.
Yeah, I'm
Yeah,
pretty sure it was
amazing,
around July when I first started
unbelievable.
last year. Yeah,
How fast time goes.
I know.
So I've been excited to kind of get your story out, because your story definitely is quite a common one in the sense of what you went through with your back, and I feel like it's one that would resonate with a lot of people with the symptoms you had and
Yeah.
all the stuff you kind of went through. So I've been wanting, as you know, to get your story out there for a little bit. But should we start, Jess? Do you want to tell people a little bit about yourself, and
Yep.
we'll go forward from there?
Yep, no worries. Busy mum of two, married, and just been in an office manager role for the last 13 years, and always enjoyed gym, CrossFit, that sort of stuff.
How long have you been training CrossFit for a while prior to the back?
I started CrossFit in 2018
Okay.
and sort of backed off when I kept sort of getting injured.
When were you just going through those cycles of back
Yes.
flare-ups?
Yeah,
Yeah.
exactly. Yeah. So, yes.
And outside of CrossFit, any other sports or exercise at the time?
No, I've never really been into much. I've done a few Spartan races over the time, different things with Spartan, and those run-in slash activity sort of challenges. But CrossFit was my biggest thing that I really got into, and
Yeah.
then I've always enjoyed just gym work as well.
Yeah. Prefer the heavy lifting side of it?
Yes,
Yeah.
yes.
And to tell us a bit about, a bit more around the back. Tell me kind of what led in and maybe the peak of your back
Yeah.
pain as it went.
So yeah, mentioned before with CrossFit, on and off, I sort of would do like hurt something with my back, sometimes a shoulder as well, but mostly my back, and it caused sciatic pain for me. Um, and it would normally stop. So a couple of months would pass, I'd back off on doing certain movements in CrossFit, and then the pain would ease and I could sort of get back into doing it properly again, doing the movements that I was restricted from doing. And then it was about 2 years ago, I'd given up CrossFit because I kept flaring stuff up, and I was sick of going up to the coaches and saying, what can we do to change the workout just for me? And I didn't want to be a burden to anyone. So I just changed to going to the gym instead and doing classes at the gym. And so then I've managed to flare up something with my sciatic again. And this time it just wasn't going away with easing off anything. Um, so yes, ended up finding out that it was my my sciatic nerve was being compressed by a herniated disc.
Yeah.
Yeah.
So when you had the flare-ups before, was it sciatica as well, or was it more localized back pain?
It was sciatica as well. It was both. It was localized back pain, but it always seemed to flare up the sciatic pain for me as well. Yeah.
Okay. And so once that kind of fled up and it wasn't calming down and you couldn't really kind of get the symptoms down to a more manageable level, what were you doing at that time? How were you trying to help it all?
So I went and got a referral so that we could do a scan and see if we could see what was going on. And we could tell that the L5S1 was where the issue was, and that the disc was compressing my sciatic nerve, which explained why I was experiencing the pain. And my first road that we went down was a cortisone injection, a guided CT cortisone injection, and it took about 3 or 4 weeks before I felt any improvement, and then the pain was gone, and I was like, okay, this is great. Obviously, you can get reoccurrences, but some people find that just that cortisone injection is enough to relieved the pressure and inflammation and stops the pain from coming back. About 5 months after that, the pain came back for me again, and I w- I decided after speaking to a doctor that I'd have a second a go at the cortisone, and about 3 or 4 weeks after that one, there was no change. So that sort of made me go, okay, what are my other options?
Yeah, okay. Well, that's pretty good. 5 months for the first one is
Yeah.
actually a good result.
Yeah.
Absolutely.
Yeah.
What what about how was your pain at the time affecting outside of training? What did your day-to-day look like when you were kind of at the peak of that pain?
It was pretty horrendous. It hurt to drive anywhere, and like instantly sitting down caused massive shooting pains down my left leg. So the longest I would drive would probably be to work because I had to go to work, and that was about a 15-minute drive, and that the whole drive was painful. Um, so sorry, what was the question again?
How did it affect you
Oh,
from a
yes.
day-to-day perspective?
Yep. So it was okay once at work because I have a sit-stand desk. So I was able to stand for a majority of my time at work and walk around the office if I needed to feel a bit of relief. And I would sit down as little as possible. But then outside of work, basically, I just stopped traveling everywhere because it was just too painful.
Yeah.
My husband would be invited to like gala events through his work, and I would just have to not go because the thought of going and sitting there and being in pain for hours on end and not being able to do anything about it was just too much. If we had social events on weekends, I'd always want to try and book somewhere that had a high table that I could stand at because sitting was just too painful for me. So, and I didn't like to let people know I was in pain. So I just would, if I didn't have a choice, I'd just bear through it where I could. But otherwise, I'd just say no and not do anything. So it was pretty bleak.
Absolutely. It has a big effect. I remember when my disc issue and my nerve issue as well. It was actually that side of things that affected me the most as well. You
Yeah.
go to a pub and I would always do the exact as what you did, which was
Yep.
pick the high stools,
Yes.
partially sit, partially stand.
Yes. Yeah, exactly. Yep.
But outside of that, I also found that it really impacted the social aspect of my life in the sense that
Mm.
I would just say no pretty
Yeah.
much to
Yeah.
most
And
things.
people don't understand because you're not nursing yourself in pain. You're just sort of trying to grin and bear and get through it. And so, yeah, not everyone understood that you were in physical pain because I would just try and pretend that I was
Yeah.
okay.
Yeah. You put on a brave face and
Yep.
try carry on with your life.
Yeah,
Yeah.
exactly.
And parenting wise with your kids?
They're a bit older, so it wasn't such an issue with them.
Yeah.
It was probably my puppy that suffered.
Sure.
But yeah, parenting wise was fine because the
Okay.
kids were old enough to look after themselves by the time I was in that much pain.
Okay. And
Yeah.
so we've had the injections, and now we're kind of back almost to square one in a sense.
Yeah.
And what happens for you from there?
So then I ended up getting a referral to a surgeon, and because I had it in my mind that I didn't want surgery, so it was one of those things that I was putting off. I don't know why I had it in my mind I didn't want surgery. I just decided that no, I would get through this, it would pass. But it got to the point where I couldn't deal with it anymore. I couldn't bear with the pain, and I got a referral for a surgeon, and we went and saw. Um, who we were recommended to see, and the surgeon said that I could opt for more cortisone injections but do them more frequently, or I could opt for surgery, which was to shave back the herniated disc that was compressing the sciatic nerve. So it didn't take me long to decide, yep, I'm just going to get the surgery done. I'm sick of this,
Absolutely.
and I wanted to do something about it.
Yeah. It's an interesting one, that the anti-surgery stance, which many people have in the clinic here. We often have to have that conversation as why, trying to figure out why people are very anti, which is understandable. It's a
Mm,
intensive, um, procedure. It's spinal
yeah,
surgery.
yeah, yeah.
But sometimes we find our position, or I find my position in the clinic, is actually almost not persuading to have the surgery, but at least getting them a little bit more, having a bit more of an open mind around the surgery.
Yeah.
because as I'm sure we'll talk about in a second, a lot of the time especially with the discectomy surgeries where they take a bit of the disc out, they can be really quick
Mm.
recoveries from the pain sense.
Yeah.
There's a bit of work to be done after, obviously, but you can get you
Yes.
from 10 out of 10 constant pain to, you know, sometimes 0 out of 10 within not long a period of time with those surgeries.
Yeah, that's right.
And so how long since the surgery now?
I had the surgery in April 2025, so a bit over a year now.
Bit of a year, fantastic.
Yes. Yeah.
Okay, so we've had the surgery and we wake up and how are you feeling post-surgery?
Instantly the pain was gone.
Yeah.
I
Was it your leg pain or your back pain primarily? Or
It was
both?
mostly my leg pain. So
Yeah.
the shooting pain that went down my left leg was what was causing me the most angst. And yep, so it was gone. Obviously, straight after surgery, I was still feeling the effects of anesthesia, so I felt nothing. um, but yeah, like leading into the days and weeks after it, I could sit down again, and I was like, "Oh, this is what it feels like to sit down pain free." It was uncomfortable, of course, because I just had surgery, but the shooting pain and the constant pins and needles that I'd been experiencing was all but gone.
Yeah.
Yeah.
Amazing.
Yeah.
It's a good feeling
Yes,
to
it was
wake up without
yeah.
it.
I was instantly happy I'd made the decision to get surgery.
Yeah,
Yep.
fantastic.
Yeah.
Okay. And then how long I can't recall off the top of my head when we started on the rehab side of things. Do you recall how long after we caught up?
Yeah, so I realized pretty quickly after surgery that I needed guidance, more guidance on what the hospital physio had provided me to get back on track. So it was about, I got the surgery in April and I think I started the program in July. So 2 months after surgery, I reached out to Back to Your Best and started my journey with you guys.
And so obviously we ran through that 6-month intensive.
Yes.
Um, Tell me a bit about the process there, because I know obviously it was relatively straightforward. I mean, there
Mm.
weren't too many big hiccups along our journey, which is
Yes.
relatively uncommon.
Yeah.
More often than not, people have their hiccups through the rehab process, which is expected.
Yeah.
How confident, if you can recall, how confident were you after surgery that you were going to be back, say, lifting heavy weights and kind of getting back to regular training as you were before the injury?
I honestly didn't think that I would get back to doing heavyweight lifting at all. Which I just had come to the decision that that's okay. I can live with my life if I never lift heavy weights again, so long as I can keep going to the gym. So um, I remember you asking me pre-starting the program, what were my goals? And I said, look, honestly, I don't care if I don't have to ever deadlift again because that was one of the ones that caused me the most issues, that movement. So yeah, I just being able to get in and do any movement at the gym was exciting for me.
Yeah. It's hard to know how far you can take it after surgery and
Yes.
after you've been through what you've been through.
Yeah.
Um, so, I mean, just on the deadlift note, obviously we're deadlifting now
Yes.
and we're doing very heavy deadlifts now, trap bar deads and barbell deadlifts as well.
Yep.
Um, do you ever think back, when you say you do your trap bar, so you got your PB last week or 2 weeks ago, maybe it
Yes.
was,
Yep.
with the trap bar dead. Do you ever think back to those days, like when you do those heavy lifts and kind of have that reflection of what you can do now versus
Yes.
where you were 6 months ago?
Yeah, I definitely do. So, um, it was probably only about 4 weeks ago, and it just hit me that, I'm finally getting up there with my numbers with the trap bar deadlift. And I when I first started the program, and I can't remember how far along I was when we introduced the trap bar deadlifts, and I was really scared to do them. And it started really low. Like the bar itself weighs 22.5 kilos. So I was hesitant to put any weight on that. But then I started adding some weight and, took it slow. And I probably sat at about the 60 kilo mark for probably a good couple of months. I wasn't really I didn't feel like I could go heavier, but I think I was also a little bit scared at the same time. And I did have a few little flare-ups where my back would sort of um, just feel a little bit tender and start feeling a little bit of the beginning of sciatic pain, but nothing, no shooting pain down my leg or anything like that, just pressure sort of in my left glute. And so I would sort of back off a little bit and go easy, and then sort of get back into it a couple of weeks later with regards to adding increasing weight. And yet to think back to back then when I was stuck at around 60 kilos, I'm like, well, that's it. I'm never going to get heavier than this. To then now hit a PB of 107.5, I think I got. So it's pretty exciting to reflect and go, oh wow, I've actually changed a lot.
100%. The
Yeah.
psychology is a big important one, like that fear component.
Mm.
I'm not sure how you feel now, but again, just personally, I know for me, for a while, I'd hit certain weights when I did my Olympic lifting, and I'd feel mentally like this is it. This must be the heaviest thing I can lift.
Yeah.
And a lot of it was just out of fear of not knowing really how far I can take
Yeah.
my
Yeah.
back. What do you think is when it comes to progressing through those exercises that invoke a little bit of fear within? How did you go from the 60 to the 70 kilo mark to the 80 and so on? Was it something that you just kind of said, well, I'm just going to give it a crack and go, or what went on in your mind to get you into that next level?
I think what helped was moving from the doing like 4 or 5 sets with a certain number of reps to then saying, okay, now we're going to switch it to trying to reach my 1 RM.
Yeah.
And that, I think, helped me mentally realize that I could lift heavier. And because you're only going for 1 rep, so you're able to just increase it and then realize, oh, I can do this, and then you can keep increasing in it, and you're not feeling any pain or pressure or anything like that. So I think for me, switching to the 1 RM, like trying to hit a 1 RM, is what made me mentally realize that I could lift heavier. And so then once you hit your 1 RM, then I've got the 2 sets of 5 reps, I think, at 80% of my 1 RM. And so pushing again for that heavier weight on more reps, it just mentally made me go, okay, I can do this, and I'm not experiencing pain afterwards. So
Yeah.
yeah,
We find kind of two ways, programming wise, that can help people increase their numbers after these kind of injuries. One is kind of eventually, you can't jump to it too early, but doing a bit of a prescription like what we do, which is work to a heavy single, and then there's
yeah,
some back off sets from there.
yeah,
So just doing 1 rep is much easier to digest and feel more confident to perform than if you've got sets of 5 or 8 or 10 or something like that. The other way is like, and I may have mentioned this to you, I can't recall, but sneaking the kilograms on. So instead of doing like 10 kilogram increases in weight, sometimes it's just popping little 1 kilo plates on each side,
mm,
where your body
yeah,
doesn't really feel it. And mentally it's like, it's an extra 1 or 2 kilos. And then each time you rock up, you add a little bit more. And after 2 or 3 weeks, you already added that 10 kilos on without it being a shock.
yeah,
It's that kind of gradual exposure, but it depends on the person's mindset about which approach we sometimes use with that.
yeah.
So rehab, obviously we did a really long-term structured program, which you did really, really well through. We got lots of rehab wins. What were some of the kind of real life wins? What were some of the changes or the big things, say, outside of the gym, outside of rehab, that you really, you've kind of achieved in the last, say, 6 to 8 months or so?
Yeah. Obviously, initially, once I could drive again, being able to drive and sit in the car was a big win for me, because I'd spent so long putting off doing social events. So driving to social events, attending social events, that was a big win, because I felt like I got my social life back again. So that was definitely one of the biggest wins, being able to live my life pain free. And strangely enough, being able to clean the house and not experience pain was really great as well.
Isn't that ironic? Yeah. Now you're back. Now you got no excuses.
No excuses, straight back into it.
That's a really common one though. Cleaning houses and like it's the day-to-day stuff a lot of the time. It's just the normal regular stuff you want to be able to do with your back that I don't know, once you get it back, you realize in a way how good it is just to be
Yes.
able to do normal, boring, mundane,
Yep.
repetitive kind of tasks like cleaning the house as well.
Yep, exactly.
So Jesse, what are some of like your learnings? What are some of the things you've learned about maybe rehab or your recovery journey so far? Things that maybe you'd say to somebody who might be going through a similar thing like you were.
I've learnt that whilst surgery worked for me, which is great, it might not be everyone's choice or what everyone wants to do, but to definitely explore all options and not just say my back is wrecked and I'm never going to be able to live my life happily again. I think a lot of people just go with the fact that, okay, well, that's it, I'm sore forever. But there's a lot more out there, and if you see the right people, which I definitely have found is the case with Scope and Back to Your Best program, that they're willing to work with you and get you back to where you need to be with regards to an injury or post surgery, even pre surgery. So yeah, I definitely think that's about that's about it.
Yeah, fantastic. And then a couple little quick hit exercise questions, I should say. What's your favorite rehab exercise?
Strangely enough, I love ab work.
Yeah.
Yeah. All the ab work stuff like the side planks and, I don't know, I really enjoy doing those.
Yeah. Well, there you
Yep.
go. You're like the only person I've ever heard who said they'd love that.
And obviously deadlifts.
And deadlifts,
Yeah.
absolutely.
Yeah.
Well, actually, I think that's a big one as well that we forgot to mention is going back to deadlifting, like the thing that you're most fearful of, I'm a big believer of getting back into. So I know in our program, obviously, we did a lot of trap bar deadlift, but only kind of recently have we done the barbell deadlift.
Yes.
And we've kind of reintroduced that as well. And I think it's always important. Doesn't have to be like your strongest lift or you have to go super heavy on it at all, but kind of getting back to the thing you originally of maybe the original thing that injured you,
Yes.
and also
It
the thing
was.
you're
Yeah.
most fearful of, which is
Mm.
often the same thing. But how big a role of getting back into something you're very fearful of or something that originally irritated you? How important do you feel like that was psychologically for your recovery?
Oh, it absolutely had to happen. I
Mhm.
don't think I could have continued, progressing as well as I did without overcoming that mentally. It
Yeah.
was yeah, t like I said at the beginning when I first saw you, I said, "I don't care if I never do deadlifts again." And that was where my mindset was. I was like, "That's okay, so long as I can go to the gym." But, to be able to realize that I can and I'm okay after doing it, I definitely needed to do the movement that injured me to get
Yeah.
past it. Yeah.
Yeah. No, it's such an important component. If we stay away from the things we're really fearful of, we never I don't think we never fully recover.
Yeah, that's right.
Definitely not psychologically anyway.
Yeah.
Well, Jesse, it's been such a great experience from my end watching your recovery, and seeing all the wins we're accumulating lately, especially the PBs. Um, it's yeah, I always wish we had like I don't know, maybe I should get one day, like a videographer who can kind of take little snippets along the journey
Yeah.
because it's very hard, I think, for people to look at, say, yourself right now and even consider where you were 8 months ago, 10 months
Mm.
ago.
Yeah.
So it's been such a nice journey to watch you get back to
Eh
kind of lifting heavy and doing all the stuff you're doing now. And it's such a big attribute to that is you've just been so consistent, which is I think one of the biggest factors that gets those results is rocking up week in and week out.
Yeah.
Whether you're having a good week or whether things are a little bit tender and sore or having a challenging week. And I think you've done that to an absolute T, which is the biggest driver I think for your results. So
Yeah.
so a big well done on that.
Thank you. It's, a lot of it, like, yep, me showing up, definitely it pays off, but I couldn't show up if I wasn't doing this program and going to Scope and back to Your Best. Honestly, the community that you guys have built and the programming and the weekly at first and now monthly sessions that I have with you is what has been made it easy for me to come and be so consistent. It's nice to show up where you are felt welcomed, and like I said, the community is amazing. So I honestly don't think I would have done this if I hadn't have gone to you guys. I would have just moseyed on doing normal gym stuff and not built myself back up properly like I really needed to.
Absolutely. And a big shout out to Ange and Amelia, obviously, who also
Yes.
create the whole gym environment and keep the
Yes,
vibe happening in
absolutely.
those sessions. Well, Jessie, thanks so much. I appreciate you coming on. And
Thank
yeah,
you.
look forward to continue seeing those PBs coming in.
Thank you very much.